Good evening, Santa Cruz County, and to the World Wide Web audience listening and watching beyond. My name is Sandino Gomez. I'm going to be your host tonight for Voices from the Village, Community Television's longest-running talk public affairs television show. And as you saw in the titles, tonight's topic is going to be Obamacare, aka the Affordable Care Act, which has become the law of the land recently and has debuted to both criticism and praise, depending on who you're asking. A lot of things, a lot of new changes in the healthcare system, a lot of changes that could impact you and your family, as well as your friends and residents in your community. So tonight we're going to be exploring some of what those changes are, how they could impact you, where you can learn more information. And we have two very talented certified educators for Covered California, which is the kind of organization that is in charge of implementing the Affordable Health Care Act and getting these kind of healthcare exchanges up and running here in the state of California. So we're going to learn more from Cindy Valdez, who is a organizer with the SEIU's United Long-Term Care Workers. And we're also going to learn from Kate Hinnenkamp, who is the director of the Live Oak Family Resource Center, which is affiliated with the larger program Community Bridges, a great nonprofit serving a lot of different communities here in our larger community. So shout out to both of our guests, and you'll get a chance to meet them in a second. But we always love to hear what you have to say, Santa Cruz. This is a public talk affair show, so what would it be without public participation? And we have, I believe, a segment from the streets of Santa Cruz talking about Obamacare, Affordable Health Care Act, the new changes in the law. So we'll be right back, and we'll introduce our guests right after this short segment. See you in a minute.
This is Voices from the Village. We're in downtown Santa Cruz, and we're asking people, what do you think about the Affordable Health Care Act, or Obamacare?
I think it's a good first step in what needs to happen in this country to deal with people and getting everyone the health care that they need. It certainly is not, it doesn't go as far as I think we really need to go in terms of taking care of everyone here, but it's a great first step. The fact that more young people are going to be able to be insured under their parents' health care plans is one good step. Providing more options for more people to, become insured is also a good thing. So, all this noise about, people's issues with it, it's a lot of garbage. I mean, we need to, ensure that everyone, not just most people, but everyone should have affordable health care.
It's a positive thing. I don't like that it's caused so much holdup with the government shutdown because of how the Republicans are reacting to it, but there are a lot of business owners that can't provide health care with the whole for however many hours people are supposed to be working, and so they're cutting back people's hours, and I think that's really unfortunate. But overall, I think it's a positive thing. I think we just need time to react to it properly.
It seems like Medi-Cal is so cheap with their income limits for qualification. It seems like a lot of people who should qualify don't. So maybe if Obamacare was more like Medi-Cal for people who can't afford insurance, then it would make a lot more sense. Because my kid's dad looked online to see the cost of insurance for him under the Obamacare Act, and it was like $250 a month, and there's no way we can afford that. So it's kind of scary. It seems like a good idea, but it's kind of scary at the same time if it's required and it's really expensive. That's how I feel.
I haven't really thought about it that much. I mean, we talked about it in class, but I don't know. It's hard for me to form an opinion because so many people have different views.
Yes, I have health care.
Uh-huh.
It's 4 ounces of wheatgrass a day, lots of exercise, and trust in the universe and my community.
I think very, very well of it. I think this is something that reminds me of what it's like in Scandinavia, where we do have national health care. Something that was never a political issue. It was a social issue that everybody could agree about back in 1920.
It's well thought out, but it's not perfect, and it'd be great if it was single payer health care, but you know what? You got to start somewhere. So I'm more than happy to go with Obamacare.
Yeah! That's what people had to say today in Santa Cruz. Back to you in the studio.
Thank you, thank you. Wow, Santa Cruz, 4 ounces of wheatgrass a day. Get yourself to Scandinavia, everything will be fine. But for the rest of us, we are going to have to learn a little bit more about this Healthcare Act. And we, again, have 2 very talented educators here that are going to be sharing information about exactly kind of how to go about that, some of the changes that have happened, et cetera, et cetera. So without further ado, to my right is seated Cindy Valdez. Again, she is an organizer with the SEIU, Service Employees International Union's United Long-Term Care Workers. Welcome, Cindy.
Thank you. Appreciate it.
Yeah. Thank you for coming on the show tonight. And to her right is Kate Hinnenkamp, again, the director of the Live Oak Family Resource Center, a wonderful organization that is part of the larger Community Bridges family of nonprofits and community service organizations. Welcome, Kate.
Thanks. It's good to be here.
Yeah. Well, we really appreciate you coming on the show. And the whole point, of course, is to get the information out. So maybe just react a little bit to what you saw from people on the streets. Anything that struck you beyond the wheatgrass or Scandinavia?
Well, I think reactions are, pretty normal, and the people seem to be well informed. Folks who are students can stay on their parents' plan until age 26, and also the issue of pre-existing conditions is no longer going to be criteria. You will be eligible for medical coverage.
Right.
Anything you want to add, Kate?
Yeah, well, a couple of things. I liked that the people who were interviewed were able to see beyond what I think is short-term drama of the government shutdown and a few technical glitches with the websites to, that this really is an opportunity to bring healthcare to millions of uninsured people. And, a couple of people had valid concerns about the cost. I mean, the good thing with Medi-Cal is there is a Medi-Cal expansion so that anybody, whether it's a single adult or a child or anybody who meets who's under 138% of the poverty level now will qualify for Medi-Cal, whereas mostly it was limited just to children in the past. So hopefully a lot more people will qualify for that program. And then somebody mentioned about limitations on employer-provided health care. The good thing with this is that now healthcare is not just dependent on being employed or being provided by the employer, that people will be able to purchase insurance or obtain insurance for themselves, even if they decide to change jobs or if for whatever reason their employer doesn't provide it.
And so that's sort of one of the big topics around the Healthcare Act is kind of between self-provided insurance versus employer-provided insurance, which are really the 2 dominant ways to get insurance prior to this Affordable Care Act.
Right.
What's the big change now with the kind of, what's the word they're using, the exchanges? Which is now a 3rd way to get health care, essentially.
Sure. So if you're within the federal poverty level from 0 to 138%, you're likely to qualify for Medi-Cal.
And should we throw out numbers? So for an individual, that's under $15,860 per year, and for a family of 4, close. That's under $32,500 per year.
Okay. Wow.
Yeah.
So sorry to interrupt you, but if you're under that level, then
it's good to get specifics out there.
That's
people hear that number, they think, hey, that's me.
Yeah.
That's really the range for Medi-Cal. And if you're within 139% through 400% or above, then you're looking at an income for an individual of $15,861 to $15,000 to $861 to $45,960 income, and for a family of 4, you're looking at an income from $32,501 to $94,200, and this makes you eligible for insurance with financial help and through the Covered California Exchange.
Right. So that's one of the big changes, is that there's these new exchanges. Companies, there's a very easy way to compare plans.
Exactly.
Online through Covered California or coveredca.com.
Yes.
And in addition, essentially there are discounts or rebates available for people who qualify based on income eligibility.
This is true.
Exactly, and they call them subsidies. The term. Yeah, and it's like a sliding scale type of thing. So if you're just over the threshold of qualifying for Medi-Cal, you get such a large subsidy that you're basically paying, for an individual maybe $5, $10 per month. And then if your income goes higher, so an individual, a family of 4 making $94,000 a year, you get a very small subsidy.
Well, $94,000 a year.
Yeah, exactly.
Do you really need one?
If you live outside of Santa Cruz, it's not good. Yeah, and these numbers, it's the federal poverty level, and so it's
a little skewed because we have a much higher
exactly.
cost of living
It doesn't
here,
take into account at all our cost of living. But that's, as people were saying that were interviewed on the street, this is a good start. It might in the future evolve that people living in more expensive places will be eligible for more subsidies, or it could evolve, but at least it's a start.
Sure, and then you have the option of choosing different tiers, different option plans. Like, for instance, you can choose the bronze, for 40/60 coverage, and then the next tier is the silver for a 30/70
What do those
coverage.
numbers refer to, the 60/40, 30/70?
So 40% to copay or expenses that you pay out of pocket, and 60% would be the premium. So for your medical coverage, and it goes, then it goes upscale to 20/80 for gold and 10/90 for platinum. And again, the higher the premium, the more coverage you have for your medical services.
So somebody who's relatively healthy might choose a bronze plan, and then they're paying a low monthly cost, but because they don't go to the doctor very often, there'll be a high out-of-pocket when they do go to the doctor, but it behooves them. But somebody who goes to the doctor all the time or takes a lot of prescription medication might choose a gold or a platinum plan. They're paying a lot for their monthly coverage, but
they're getting lots of access when and where they need it.
They get their medications and go.
So it kind of allows you to tailor your healthcare plan sort of to your healthcare needs.
Exactly. And as you alluded to, the exchange, the purpose of it is you can really compare different plans side by side. And even though there are different private insurance providers on the exchange, the plans are basically identical. The only difference is, first of all, that you're interacting with different insurance companies. Maybe you have a preference of customer service from one to the other, and then what providers they work with. So not every provider is going to be on every insurance company. So people who have a provider that they want to keep, if they are going to buy a plan on Covered California, they want to make sure that that provider is listed under the carrier.
And if people don't have a primary healthcare provider, like what does that mean? How does that impact the exchanges, I guess?
But if they would I think they probably have to name one when they're signing up for the plan.
Sure. You have several options, and you just have to identify.
Okay. So you kind of try and pick a doctor as you get your insurance?
Yeah. And these plans in the Santa Cruz, Monterey, San Benito County area, they're EPO plans, which is something in between an HMO and a PPO. And I honestly am not super clear about the specifics about that, but it's somewhat managed care, but you have a little bit more choice, I think, in terms of.
Yeah, and you have in the Central Coast, you have 4 medical providers, which are Blue Cross, Blue Shield, HealthNet, and Kaiser.
No, I don't think Kaiser.
Covered California.
Yeah.
So they had to be
through those agencies.
Through those agencies.
And is it just private insurance companies that are on the exchanges, or are there like government public options or anything like that?
It's just private.
It's just private insurance.
It's just private. Okay. It varies from county to county.
That's what they fought against, right? The public option, quote unquote. Wasn't that like huge controversy?
Yeah.
Yes.
Okay.
At this point, there is no public option, except for Medi-Cal if you qualify for Medi-Cal.
Right. Okay. Now, I've read a lot of criticism about this kind of new law and the kind of that it's coming up short, essentially, on what we would have really liked to have, which would have been like for Medicare for all. Could you just explain like what the difference between like single payer healthcare and like what's going on with the new law and kind of what's the difference? Because I think some people are even still confused around that, like what's happening. They think it's like some sort of like, it is mandatory that you buy the healthcare, but I think people are confused about what their options are when they buy it. So there's no public, there's no single payer system, quote unquote, but there are all these private options. Summarizing correctly?
I'm not really sure about the single payer, but one thing is for certain that is through this Covered California option, your it's affordable. It's 0 to 9.5% of your annual income.
Okay.
So
trying to cap the percentage that you spend on your health care?
Yeah, and one thing we forgot to mention with the percentages that the different plans cover is there is, for all of the plans, a limit to your out-of-pocket costs. So even the cheapest plan, the most an individual will spend out-of-pocket is like $6,000 a year.
Exactly.
So even if you get the bronze plan. Yeah, I mean, I guess I would think of the mandate almost more similar to like what it is with auto insurance now, that, it's just a requirement, but the government doesn't provide you with auto insurance. I mean, you go out and purchase it. This is better in that you have the exchange, so you can actually compare side by side these different plans, and they have these 10 essential benefits that all of the plans cover, which is, like your regular doctor's office visits, your specialist, your emergency room visits, mental health, maternity care. Yeah, preventive care. And now for everybody under any plan, preventive care, there's no copay. So you can go to your annual physical or a well-child checkup. You pay zero out-of-pocket costs. But really the mandate doesn't mean, like you said, it doesn't mean that the government is going to provide it. It means that you're required to purchase it. Yeah. The exchange helps you compare side by side to choose, and it also, if you qualify, there's a subsidy that helps you pay for it.
Right. Okay.
Yeah, but in the sense of it being provided by the government, it's not. And all the exchange is sort of, they compare it to like, Priceline or Expedia or something, where you just go online and you basically can see, if I want to fly to LA, these are the different carriers.
It's not the airlines fighting for our dollars, it's the healthcare companies.
It's the healthcare companies.
Okay.
Yeah.
So explain the process, like if someone like myself, who's underinsured, were to want to go about this, are there like resources in the community, like beyond just the website? Like how do people get connected to folks that might be able to help them through the process, especially if maybe there are like language or education barriers?
Sure. There's some workshops being held in Watsonville, in Santa Cruz, and we would like to recommend that they contact the number on the screen, 510-409-8950, to attend one of the workshops. And you can learn about Covered California, as well as talk to an enrollment counselor to help you enroll.
Okay.
Yeah, and I'm here representing Community Bridges and the Family Resource Centers. So we have 4 Family Resource Centers county-wide. I'm at the Live Oak Family Resource Center, and we have certified educators and enrollment counselors, and people can just walk in during our office hours. So that Live Oak Family Resource Center is at 476-7284. In Watsonville, people can go to La Manzana Community Resources. The number there is 724-2997. In Felton, people can go to Mountain Community Resources, which is 336-8172. And in the heart of Santa Cruz, people can go to Familia Center, which is 423-5747. And we have certified education and enrollment people at all of those sites.
Great. So 4 awesome community organizations which are providing essentially counseling and enrollment assistance.
Exactly.
And you just listed those 4.
And there's no obligation. People can come in and just ask questions. Get information, and then if they're interested in signing up, or when they're interested in signing up, they can.
Sure.
And there is
and the website is here. I think you have this on your screen.
Let's try
There's the actual website, and also an 800 number if you just want to ask someone some questions in determining, or you could also enroll by phone. You can talk to a person, enroll by phone, go to the website, or come to one of the workshops and talk to an enrollment counselor.
Definitely. And people can, if you feel comfortable doing it, you can fill out your own application at coveredca.com. And so really the face-to-face is if you feel more comfortable talking to a live person. And at all of our family resource centers, the staff is bilingual, so it's Spanish-speaking.
Okay.
We're trying to make this as easy as possible.
Yeah.
And, this first year you do have open enrollment. It's effective now. It started on October 1st, and it's through March 31st of 2014. And then next year, it'll start October 1st, and it'll run through December 7th of 2014.
And what is that period for? Like, what is that time?
That's the time to change. So this is your first year, for October 1st through March 31st. You have this time to enroll into either Medi-Cal or Covered California, one of the exchanges, or for the following year, which is 2014, that open enrollment period will be October 1st through December 7th. And that'll give you a chance to change if you're not happy with your option.
So the exchanges are essentially only going to be open for those time periods?
For people who want to just enroll because they're currently uninsured. So people who don't enroll by March 31st of 2014, they will not be able to enroll until October 1st. Okay. And they will be subject to the penalty that people probably have heard about. Okay. And that's going to happen at the time they file their income taxes.
What's the hard facts on the penalty?
Cindy's
a lot of lot of misinformation sounds like it's going around.
So for the first year, it's $95 per person or 1% of your annual income. The second year, it's 2% or 325% of your annual income.
$325?
I'm sorry, $325.
It's like, so man, they're going to charge me that much?
It's 2% of your annual income or $325, whichever is greater in each of these cases.
Okay.
And then, 2016 and beyond, it goes to 2.5% of your annual income or $695 per person, whichever is greater.
Okay.
So,
but of course,
so it behooves you to get on this now because you got about 5-6 months before the exchange is shut until October.
Yeah.
Exactly.
And then I guess what happens in those 5 or 7 months between March and October? What will happen at that point?
People can enroll if they become uninsured due to change in life circumstances. So if somebody loses a job, if someone has insurance through their partner and they become divorced, if somebody has a child and they need to insure that child. So under those kind of circumstances, people will be able to enroll in the
But not just because you forgot.
Not just because you forgot, and definitely, not, and unfortunately not because you suddenly become sick. You can't just say, oh, now I need insurance.
Now I need health care.
Yeah, which obviously, I mean, this penalty exists, but we want to remind people that we're definitely not looking at this as the main reason people should get insured. I mean, the first thing is that people who have health insurance are healthier, that they're able to get preventative care, they're able to deal with health problems before they become a crisis, before they have to go to the emergency room. And then the other reason is that even a really young, healthy person, there can be a catastrophic thing. Somebody, I mean, this is Santa Cruz, somebody's surfing or skateboarding or doing whatever other extreme things people do, riding their bikes. And, it can be tens of thousands of dollars in an instant. We had a story of somebody who was airlifted, and over to San Jose, and that's $20,000 right there, not counting anything else.
Suddenly your $5,000 deductible doesn't look so bad.
Right, yeah.
And it's the number one reason why people file bankruptcy. So you don't want to find yourself in that position.
Certainly.
Especially young people. I mean, not a good way to start, life as an adult.
Go into debt. Welcome to America.
Yeah, so, we really want to encourage people to think of it as a positive, that this really is... It's for everybody's benefit.
Okay.
Sure, and just to clarify, the age ranges from 18 years to 64. So beyond 64, you're really looking at Medicare. So just want to be clear about that.
And also, if any children that are uninsured, if their families fall in the income range, they would also enroll in Covered California. And I don't think we said or made clear that we're talking about Covered California and Medi-Cal as if they're somewhat separate, which in some ways they are. But for the consumer who wants to sign up for health care, they're not really going to see the difference until they actually get enrolled. So you can sign up for Medi-Cal exactly the same way by calling the 800 number, by going to the coveredca.com website, or through any educators or any enrollment sites such as Community Bridges, Family Resource Centers. So people would fill out the same application, and then if you qualify for Medi-Cal, your application is just sent over to Medi-Cal, and you proceed that way.
Okay, so they're going to be kind of doing referrals as appropriate?
Yeah, well, but more than referral, that you actually fill out the application, and so you've already applied for Medi-Cal.
By doing the Covered CA thing, they'll just notice, hey, actually, you qualify for Medi-Cal. We're just going to send you straight there.
You'll know.
Yeah, okay. You don't have to navigate two bureaucracies. Great.
No.
Exactly, yeah, and hopefully it's going to streamline the process of people getting Medi-Cal, because I know that can be challenging sometimes.
Well, I just want to let the audience know that this is a live program. What is it? Sunday, October 13th. So if you're watching right now, you can do a call-in. If you have a question for Cindy or Kate, please feel free. There's a number on the screen, 425-8844. I should have it memorized, but I had to look over there. Sorry. And feel free to give us a call. We do appreciate your participation. By all means, Santa Cruz, give us a call. Let us know about your healthcare problems or crises, or what you think about the Obamacare Act. Or if you have a question for either of our two guests, by all means, please participate. This is your television show. I'm curious because this question applies to me. What if you have insurance either through private purchasing or employment, and do you have to drop it or change it? Is there what's the situation at this moment? Like, I have catastrophic insurance, right? Like, just exactly the situation you were talking about. My mom's terrified I'm going to get hit on my bicycle or, do something stupid and end up in the hospital. So she's had essentially catastrophic insurance for me this whole time that I've been off her program or off her plan since graduation and all that. So I'm just curious, how does this law impact someone who already has coverage?
Well, we really recommend that folks who have insurance now that they keep it. Again, we don't really want to target folks who have insurance already. We want to target folks who are underinsured or who are not insured.
Well, I'm concerned because my plan is going to shoot up 200-300%, something like that.
So my understanding, and I could be wrong, I'm not super well prepared about this, but my understanding is that these 10 essential health benefits are now required to be included in all insurance policies. So if you got notice from your insurance company that your policy has suddenly gone up, it's because your coverage has suddenly gotten way better.
Yeah.
And so that all plans have to have I don't know if they all have to have that $6,000 a year limit. I'm not sure about that part, but they have to cover all of those 10 essential things.
I think in order to be covered California certified.
To be covered California, but not if they're a private. off the exchange. Yeah. Have you had a chance to look at sorry to put you on the spot.
No. Are you kidding? This is why I'm doing the show. I need to talk to you too.
Because there is a calculator, we haven't mentioned that, but if you go to coveredca.com, there is a calculator that pops up and you just put in your information, how many people in your household, how much money do you make, how many people do you want to insure, because sometimes it might be that somebody in the family is already insured and not everybody needs it, and then it will give you an estimate depending on which plan you want.
It's quite user-friendly.
Kind of like a recommendation, like which plan, bronze, silver, gold, platinum, or like what kind of recommendation?
It won't give you recommendation, and a certified enrollment counselor won't give you recommendation either. It really is, it lies with the consumer, but what we can do is kind of explain the pros and cons. How often do you go to the doctor, and you can
But you can
decide.
actually include that to see what the difference is in your actual copay or your premium cost.
Yeah, it'll show you all
So I could look at my current plan compared to something on the exchange and decide if it were worth switching, essentially, because that's what I'm understanding is my insurance, I know I qualify for some of these subsidies, number one.
Yeah, sure.
And two, this plan that I've had is about to triple in price, so why wouldn't I look at some other option? I know you're saying a lot of the outreach efforts are going to people who might be uninsured, 45, 50 million Americans that are in that situation, but I think there's a lot of people in my boat too that are really confused about what I'm supposed to do at this point.
Well, folks who already have insurance through an employer are not really eligible for Covered California. You can buy it, but you can't get any kind of a subsidy if you're opting out of your employer. So we're really not encouraging people to opt out of their employer-provided coverage. But people who are buying insurance on the private market on their own, you most certainly can drop that and buy on the marketplace.
We're really looking at 2.6 million folks out there in California to get them insured. That's really the number that we're looking at.
That are uninsured now that we want to get insured?
Exactly. Because that's where the highest need is.
Where is that based? In the state of California, where are those people for the most part?
Well, there's the huge bulk of folks here in Northern California, in the Central Coast, and also in the Los Angeles area. That's where the highest numbers are.
Just the population centers. So.
Yeah, that's really
environments, maybe.
Really,
just there's more people.
Population-wise,
sure.
And the demographics. I mean, it's all sorts of people, but a lot of young people are uninsured, a lot of, well, it kind of goes, it's a lot of different races, ethnicities. A lot of self-employed people, you know, are not insured. So those are some of the groups that, you know, we're encouraging to enroll. I think seniors, maybe people who might be retired, if you're lucky enough to retire before age 65, before you qualify for Medicare. You know, there's people who are kind of in the in-between years there.
Right.
So that's a good demographic also. But yeah, and certainly, you know, anybody can go on the website and look at the calculator and see. And then if you try to apply and they say, well, no, you don't qualify because you already have this other insurance option, then, you know, you don't lose anything.
Okay, so there's no cost to check it out.
Most definitely not.
And not to go talk to any of the 4 counseling centers that you mentioned too.
And thanks for mentioning that. You should never have to pay for, you know, this kind of information or to get assistance in enrolling because and if you do come across someone who's trying to charge you, do report that to the Covered California website because that is, you know, not...
That's some serious shenanigans.
It is. Yeah, it's not the right way to do it.
You can go to a private insurance broker, and it's the same thing. They get some sort of a... Kickback's not the word, but they get some, they get money from Covered California or from the insurance company per enrollment, but the consumer shouldn't have to pay anything, even if they go to a private insurance broker.
Okay. What have we missed here? Like, what important facts have we not touched on? I'm thinking we got through a bunch of this. I mean, this law just took effect. Everyone in the country is affected by it.
Everyone is, although we like to say, you know, if you're happy with what you already have, you know,
you don't have to.
You don't have to change.
Necessarily change.
Oh, and just to mention that the FPL, the federal poverty level, is based on inflation and also the cost of food and other factors. That's how they came up with the 0 to 38%, and you know, 139% to 400% to make people eligible. They're looking at demographics, and they're also looking at the cost of food and cost of inflation. Those are the main factors.
Okay.
Can we repeat our information of where people can go to
Please, I think that's a fabulous idea. And again, I want to repeat to our viewing audience that this is a live television show, Sunday, October 13th. Give us a call. Let us know what you think. Phone number is on the screen, 425-8844. Feel free to say hello to either myself or our 2 guests with a question or comment about Obamacare.
So one place people can go for information or to enroll are any of the Community Bridges Family Resource Centers, such as the Live Oak Family Resource Center, 476-7284, La Manzana Community Resources at 724-2997, Mountain Community Resources, that's in Felton, at 336-8172, Familia Center in Santa Cruz at 423-5747. And you can call or you can drop into any of those family resource centers during open hours, and there's certified staff there to help you in English or Spanish.
Fantastic. And other locations in Santa Cruz County are in Watsonville at 10 Alexander Street, and of course the Live Oak Family Resource Center. And we would like to encourage folks to RSVP to the number 510-409-8950 to talk to get more information on Covered California, and also to talk to an enrollment counselor.
Okay. Well, again, my name is Sandino Gomez. We're here with Cindy Valdez from the SEIU's United Long-Term Care Workers, also with Kate Hinnenkamp from the Live Oak Family Resource Center, which is a program of Community Bridges. And we're talking about the Affordable Health Care Act and what those changes mean locally here in Santa Cruz County. In addition to the 4 kind of resource centers you mentioned, are there like individuals? You said also, I think people could go to insurance agents. Is that just about any insurance agent, or are they certified?
They do have to be certified.
Okay.
Yeah, and I saw a thing in the Sentinel just this weekend that there's not a lot of folks who are certified, but yeah, it's a process, as it has been for us also to get certified. But I think more and more people will become certified. But there's other agencies. I know healthcare providers. I believe Santa Cruz Women's Health Center is doing enrollments. Salud para la Gente is doing enrollments.
In Emmeline.
Yeah, sure. You can go to the county.
County healthcare services.
Yeah. So you can go to the county buildings on Emmeline. And there are lots more, I think, as well. And
as time progresses, more and more folks will have enrollment counselors.
Yeah.
Okay.
So we're really basing it on need.
Yeah, and we're still pretty new. I mean, this law is only 13 days old, so
sure.
There's going to be a few glitches here or there. And
it'll be interesting to see how many folks will do their own enrollment online and on paper and by phone, and how many folks will actually want to talk to a counselor. That's really where the need is going to come.
Well, certainly, I think a lot of people probably prefer just that little advice or that human interaction.
Yeah.
And hey, speaking of human interaction, we have a question from our studio audience. So why don't we take this question from Keith, if I'm not mistaken?
That's right. I've been to the website, and I had a question. There's 3 healthcare providers for our county, apparently. And I was trying to find out if they cover my doctors or not. And I looked all over the website and couldn't find anything. And I saw that in the Sentinel article that part of the website's not working yet. I wondered if you could comment on whether it's going to be working on the website, and if you know if any of the major providers in this county are covered. I mean, are they going to cover Dominican, or are they going to cover Watsonville Community Hospital, the Santa Cruz, what's it called, PAMF now? I mean, those are major providers in this county, and I can't find out whether they're covered. So thanks.
That's a great and important question. I personally don't know exactly the specifics of the different plans and exactly what providers and hospitals are included. And there definitely do appear to be ongoing glitches with the website. But I believe what my understanding is that they are in the process, if they have not already updated it so that information is included. But if it's not, what I think you can do is go to the websites of those different insurers. So like if Anthem or Blue Cross or whatever it is, you can go to the website of that insurance provider, and there you should be able to find a list of what providers are covered. And yeah, for people who have a provider or a network that they prefer, definitely you want to find that out before you sign on to a plan. And you can also wait until that information is the website is functioning smoothly, and you can find that on the Covered California website.
We have till March.
That's right. So, if you want your coverage to start January 1st, you want to be enrolled by
December 7th.
December 7th
Okay.
is what we're being told.
But we could also call the 800 number to talk to somebody in person.
1-888-975-1142.
Yes.
Okay. That's the one.
What have been some of the obstacles towards implementing the Healthcare Act? I mean, I think the Republican-controlled House tried to repeal it 40-something times. It's essentially led to this government shutdown. I'm just curious, what have been some of the obstacles besides just, the long process to get the law in the first place? And now that we have it, what are some of the obstacles to implementing it?
Well, the government shutdown isn't exactly an obstacle for us because we've already been budgeted for this program and to do the outreach and enrollment counseling. It's been a slow process in getting material, and for instance, Covered California only allows a material that's been approved by them, like with this logo. So that's why we want to make sure that folks, whoever you're talking to, you see this logo. That's the official Covered California logo. So receiving this official documentation and applications, it's been a process, and so it's been a slow process. So that's one of the obstacles. We would have been able to start our outreach, back in August, if we had received information ahead of time, but it's been slow in coming. And as time progresses, there'll be more enrollment counselors as well. So
definitely, yeah, it's a massive undertaking, and yeah, I mean, it's certainly anybody who watches the news or reads the paper, knows that there have been glitches. I guess from my perspective, and Cindy and I had the opportunity to go up to San Francisco to a Covered California event and saw Nancy Pelosi and Tom Maminano and some of those big wigs, and the head of Covered California, I guess, was there.
Yes.
And I was very impressed by a lot of things that day, and I really believe that California is doing a great job and really wants to do this right. And there's so many little details with this outreach and education program, all the research they've done into exactly what demographics need to be reached, and all the dozens of languages spoken by immigrants in California, and making sure that there are outreach groups that are going to target all of those different demographics of people. And to do something right, obviously, it takes more resources and it takes more time. And even though this law was passed a while back, it's still kind of felt sort of rushed at the end. And so I think it's all going to come together. But yeah, it's been a massive undertaking, and yeah, some of the details are still being worked out.
Sure, and although we want to help everyone enroll, there's a high percentage of Latinos and a high percentage of Asian folks who really are, underinsured or not insured. So it's having accessibility in bilingual forms is very important to us as well.
And all these sites that you mentioned have bilingual counselors available to kind of guide people through the process.
Here in Santa Cruz County, Spanish and English, definitely, yeah. Another thing that we haven't mentioned that is a challenge, and that is for us that work so much in the Spanish-speaking community, an unfortunate thing is that undocumented folks are not eligible for this. They're exempt from the penalties, but they're not able to purchase insurance.
Oh, irony.
Yeah.
It is unfortunate.
And so, and a lot of families that we speak to might be a kind of a mixed immigration status, where some people are documented and some people are not.
Right.
And so in that case, like if the parents are undocumented but the kids are citizens, then the parents are able to obtain insurance for their children, but not for themselves, unfortunately.
Wow.
Which is why here, it's
like,
great.
what are people like that supposed to do?
Yeah.
I mean, like, how's...
Talk to our representatives.
I mean, barring some massive immigration reform, but let's say an undocumented person is horribly injured. Like, what are they supposed to do, essentially? And does the law help them in any way?
The law, I wouldn't say helps them in any way. I mean, there are emergency things that kick in if a catastrophic thing happens, thankfully. But again, it comes back to that, preventative care. And if folks have diabetes or, a heart condition or whatever, that it gets worse and worse until it does become a catastrophic kind of thing.
Which is essentially the whole argument for the law in the first place, right? Like, let's prevent these things. Yeah. But what about something completely unexpected or preventable, like say a car accident or something?
Right. So there are emergency things that can kick in to help people
get access to services.
Yeah, certainly get access to emergency services. Here in Santa Cruz County, and I think Monterey County as well, there are really good safety net clinics, and their role is going to change a little bit now that most people who are citizens or legal residents are going to have health insurance, and so the safety net clinics really are going to fulfill the role of helping the people who fall through
the traditional systems.
who don't qualify for any of those systems. So places like Salud para la Gente, Santa Cruz Women's Health Center, the county clinic, and those other kinds of providers, Planned Parenthood, become really, really important.
Right. Okay.
I should do a shout out in Live Oak, where I live and work. Santa Cruz Women's Health Center is opening a new clinic, hopefully sometime by the middle of next year, and they will be serving men, women, and children. So that'll be huge. So we'll be referring a lot of folks who are still uninsured to
what part of Live Oak?
services.
That's going to be? That's great.
That's going to be at East Cliff Village, the end of 17th and Portola.
Yeah, the shopping center over there.
Yep.
Yeah, great.
Yeah,
super
so that's
cool.
exciting.
I do believe we have another question from our studio audience, so let's pan over to Betsy and see what she has to say.
Hi. So if I signed up for the Affordable Care Act today, it's not going to start until January, right? But do I start paying for it today?
Well, that's a good question. My belief is as soon as you officially enroll, I believe you do have to, pay whatever plan option you choose.
I don't think before it takes effect.
But you may be able to.
It's like, man, that's
you may be able to make any changes, before March 31st. If you were to decide to change your options, you also have that option to change your choice of your plan option. So.
That's a good question. I would speak to neither of us. We're both certified educators. Neither of us have gone through the enrollment counselor training, so I'm not 100% sure. But that wouldn't make sense to me. I mean, I think that your payments would start to be due when your policy goes into effect. And the only reason the open enrollment started so early in October is just because we anticipated, or Covered California anticipated, so many people were going to be enrolling. And so if you get your act together and enroll early, it doesn't make any sense that you would be penalized for enrolling early when your policy doesn't start until January. So I would guess the answer to that is no. I mean, I don't know exactly the specifics. That's definitely a question you should ask the enrollment counselor or call the 800 number.
Yeah,
and get
my first instinct is that you start with your first payment and then do your monthly dues beginning next year. But again, you can talk to an enrollment counselor or call the 800 number.
Do you find that there's a lot of people coming to the enrollment counselors? I tried calling on the phone and I couldn't get through. So I'm wondering if it would be easier to get in to see an enrollment counselor in person than to be on the phone.
We didn't really know what to expect. It hasn't been. People are not beating down our doors. I think people are kind of sitting back and watching what's happening and getting more information. But the question is, are there enrollment counselors available to help you? Definitely. I mean, there won't be a lot of competition at this point. So yeah, we'd be happy to help you at any of our family resource centers or some of the other places that we mentioned that are open for business.
Thank you.
Yes,
thank you.
You have options. You can go online,
Yeah.
you can talk to someone on the phone, or you could just cruise on down to La Manzana Center.
There you go.
Talk to someone.
Sure.
Exactly.
Great. Well, we've got a few minutes left, so I just want to again invite you, if you're out there watching and you've just got that burning healthcare question, you should probably go see a doctor. But if you have a healthcare question for our two certified educators, well then please give us a call at 425-8844. I think maybe we could just say a few words in Spanish about our the different sites. Basically, let's do a quick summary, if you wouldn't mind, about a little bit of what we talked about tonight, and maybe we can go through those the list of sites where people could seek in-person counseling in addition to the website and the phone number.
Sure.
Entonces, para la gente que están mirando, yo soy Sandino Gómez y estamos aquí en el programa Los Voces del Pueblo, pues, y estamos hablando del nuevo ley federal de salud que se llama Affordable Health Care Act, ¿no? En inglés, pero también está conocido como Obamacare. Y estamos hablando con una persona que está muy educada y puede hablar de los puntos más importantes de la ley. Entonces, estamos aquí con Cindy Valdez, que trabaja por el sindicato Service Employees International Union, que es como también conocido por sus letras SIIU. Y bienvenido. Y por favor, explica un poco de la nueva ley, dónde pueden buscar información y qué están haciendo con estas leyes.
Sí, personas que están dentro de los ingresos de 0 a 138% del nivel federal de pobreza, como por ejemplo un individuo que tiene ingresos de $15,860 al año, puede ser elegible para medical. Y para una familia con ingresos de $32,500 también puede ser elegible para medical. Y para personas que tengan ingresos de $15,861 a $45,960, con esos ingresos puede ser elegible tal vez por subsidios con la cobertura de Covered California, y para una familia de 4 que tengan ingresos de $32,000 a $94,000, también podría ser elegible para subsidios de Covered California. Y lo que hace una aseguranza, o sea, asequible o que sea algo que de bajo costo, si usted paga de 0 a 9.5% de sus ingresos, eso es algo que se considera que es de bajo costo y que es algo que la familia puede pagar. Y entonces, si esa es una nueva ley y las personas que sean residentes legales y ciudadanos de los Estados Unidos son elegibles, y si no se inscriben, entonces habrá una multa, como por ejemplo tienen desde octubre 1 hasta el 31 de marzo para inscribirse, y si no se inscriben durante ese tiempo, entonces habrá que pagar una multa de 1% de sus ingresos o $95, el precio que sea más alto. Entonces, por el bien de todos, sería mejor que todos tuvieran cobertura médica. Y otra cosa que gustas incluir en
pues
eso?
si la gente quiere más información, if we could put the Family Resource Center phone numbers up again, please. Para más información o para inscribirse personalmente, pueden ir al Centro de Recursos para Familias de Live Oak o llamar al 476-7284. Si están en Watsonville, pueden ir a La Manzana. El teléfono es el 724-2997. En Felton pueden ir a Mountain Community Resources o llamar al 336-8172. O en Santa Cruz pueden ir a Familia Center. El teléfono ahí es el 423-5747. Ahí pueden informarse más o pueden inscribirse para un plan.
Y también si gustan atender un taller sobre Covered California, en Watsonville, en la oficina de 10 Alexander Street, habrá talleres disponibles allí y podrá hablar con un consejero, y también, como de nuevo, en el Centro de Recursos para Familias en Live Oak. Y si gusta, si le interesa atender a uno de esos talleres o hablar con un consejero, puede también llamar al 510 409-8950.
Ok, entonces hay una nueva manera de conseguir seguridad en el estado de California que está bajo de Covered California. Hay páginas de web, hay números de teléfono y también hay lugares donde la gente puede ir. Y la nueva ley dice que la gente tiene que comprar seguridad o van a pagar una multa.
Sí.
Entonces
Sí.
hay opciones para que estar bajo de costo y la gente pueden pagar para seguridad. Hay muchas opciones y también descuentos o subsidios para que la gente pueden pagar y tener seguridad para su familia y, bueno, sus queridos.
Sí, seguro. Y lo bueno también incluye que puede hablar con alguien en persona de Covered California. Aquí está el número. Y aquí está la página de internet donde puede visitar. Y otra cosa que es tan importante es que ya no tiene el problema de ser rechazado con una condición preexistente como asma o diabetes o problemas con el corazón. Ya no va a ser un problema en registrarse para cobertura médica.
Solo hay como 3 calificaciones, ¿no? Ya su edad, su lugar y como sus ingresos, ¿no? Son los 3.
Eso es lo que afecta el precio.
Y el precio.
Sí. Eso es lo que afecta el precio, pero todos son elegibles a pesar de todo eso. Tampoco si la gente que fuma no pagan tasas más altas. Claro, pero no fumen.
Por favor.
Y también que los jóvenes pueden estar bajo la aseguranza de sus padres hasta los 26 años de edad.
Sí.
Ok. Entonces, si tienen seguridad de su empleo o que si están comprando seguridad del mercado privado, falta de mejor palabras, hay opciones diferentes ahora y la gente debe investigar cómo se pueden encontrar seguridad que está bajo de costo.
Sí, sí, y también estas son para personas que no tienen seguridad médica en este momento.
Yeah.
Para personas que ya tienen seguridad privada o a través de sus empleadores, no les sugerimos que se apliquen,
Yeah.
al menos que sea algo costoso, como si están pagando más del 9.5% de sus ingresos y sea demasiado costoso para ellos. Pueden averiguar con llamar al este número de 800 para hablar con un consejero.
Okay. Qué bueno. Pues, ¿entendiste Santa Cruz? Espero que sí. We sure hope you understood all of that, and if not, well, learn Spanish. But we basically repeated the same things that we've been talking about for a while, because we do recognize that a lot of the underinsured communities in our communities often don't speak the dominant language, and migrant folks especially have to have just more access, shall we say, or just specific outreach. And I just appreciate both of you for saying all of that in Spanish as well.
Definitely.
So,
Could I?
Yeah.
You just reminded me of something that's important to say. The folks that are employed seasonally, it's the requirement. They're not exempt from the requirement. So if somebody has a job that insures them 9 months out of the year or 6 months out of the year or whatever it may be, if their employment ends and their insurance coverage ends, they are required to purchase a policy through Covered California or possibly apply for Medi-Cal if they qualify for Medi-Cal for those months that they're out of work and not insured.
well, I can tell by the theme music that we've run out of time, but I want to thank you both for being with us. Cindy Valdez with the Service Employees International Union, United Long-Term Care Workers, Kate Hinnenkamp with the Live Oak Family Resource Center, a program of Community Bridges. Thank you both so much for being on the show.
Thank you. Thank you for inviting us.
Yeah, no, really, we appreciate it. Getting this information out is very important. And yeah, adios.